Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, AG ratio high or low albumin globulin levels and related conditions. The AG ratio is a test that measures the amount of proteins called albumin and globulin in your blood. The AG ratio may be performed as part of a routine blood test called the Comprehensive Metabolic Panel (CMP), or ordered if you have certain unusual symptoms like hematuria, blood in the urine, or jaundice, yellowing of the eyes or skin. /R/N/R/N a high AG ratio may indicate kidney disease, an antibody deficiency, or severe dehydration. A low AG ratio can also indicate kidney disease, liver disease, chronic infections like HIV, autoimmune diseases like lupus, and certain cancers. /R/N/R/N This article explains why the AG ratio test is used and what the ratio of albumin to globulin says about your health. It also describes what you need to do if your test results are high or low. /R/N/R/N Getty Imagesrnrn The AG ratio describes the amount of albumin compared to the amount of globulin in your blood. Albumin and globulin are major proteins in your blood, called serum proteins. They have different purposes in the human body, as follows: /R/N/R/N Under normal circumstances, there is slightly more albumin in your blood than globulin. /R/N/R/N Although the reference ranges of values, meaning the range between which test results are normal, can differ by the lab, an AG ratio between 1.1 and 2.5 is generally considered normal. /R/N/R/N When your body is functioning normally, the proportion of albumin to globulin will remain relatively consistent. When the proportion changes and the AG ratio is low, it may be a sign of an infection, disease, or nutritional deficiency. /R/N/R/N Your AG ratio may become low for three reasons: /R/N/R/N Low albumin, hypoalbuminemia, is most often due to the reduced production of albumin by the liver or the excessive loss of albumin in urine, due to a kidney problem. Chronic inflammatory diseases can also make blood vessels more permeable, leading to albumin loss. /R/N/R/N In contrast, high globulin levels are typically a sign of inflammation or the activation of the immune system to fight an infection or disease. /R/N/R/N To this end, the possible causes of a low AG ratio include /R/N/R/N A low AG ratio does not cause symptoms other than those related to the underlying cause. /R/N/R/N Your healthcare provider will often order an AG ratio test if you have signs of chronic kidney disease, including difficulty urinating, ankle swelling, and ammoniasmelling breath, or liver disease, including jaundice, dark urine, severe fatigue, and pain in the upper right abdomen. /R/N/R/N A high AG ratio is far less common than a low AG ratio and may occur when /R/N/R/N globulin levels can drop when your body does not produce enough or an excessive amount is eliminated through the kidneys when you urinate. In contrast, the only situation in which albumin can abnormally increase is with severe dehydration. /R/N/R/N To this end, possible causes of a high AG ratio include /R/N/R/N A high AG ratio does not cause a set group of symptoms. In many cases, there may be no symptoms. /R/N/R/N However, people with low immunoglobulins are vulnerable to recurrent pneumonia, bronchitis, sinus infections, ear infections, meningitis, or skin infections. /R/N/R/N An AG ratio cannot diagnose any medical condition on its own, but it can point your healthcare provider in the direction of possible causes. Other tests can help characterize the nature of the problem and help narrow the causes. /R/N/R/N These involve lab tests like /r/n/r/n imaging tests and specialist procedures may be also used if a gastrointestinal disease or cancer is suspected, such as /r/n/r/n. An AG ratio is a blood test that compares the amount of two proteins, albumin and globulin, in your blood. A normal AG ratio is between 1.1 and 2.5, although this can vary by lab. /r/n/r/n. A low AG ratio may be due to kidney disease, liver disease, chronic infections, type 2 diabetes, malnutrition, certain autoimmune diseases, and cancers. A high AG ratio may also be due to kidney disease as well as severe dehydration, pregnancy, and antibody deficiencies. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.